I'm going to start by asking you all to think about autism for a second. Many of the people in the room here today might be thinking of a child, probably a young child, a boy, and a white boy at that. But actually, we know that we don't have any real gender or racial variation in autism. It's all down to historical diagnostic practices. The best evidence we have today suggests that 1 in 36 people are autistic. So if we've got 500 people in the room, we've got at least 10 autistic people here. But many people might not know. They might have been the clever person at school who goes undiagnosed into adulthood. The reason I'm talking to you about this today is that I did a decade of postdoctoral research on maternity. I focused on marginalised and underserved communities. We had some disabled people, we had a lot of people on low incomes in stigmatised locations. And then in 2019, I was diagnosed as autistic in a big surprise to myself. Not very long afterwards, during COVID lockdown, I experienced an ectopic pregnancy. I told my clinicians I was autistic. I told them the things that I needed. And I am extremely grateful that they gave me the emergency surgery and saved my life. But the care I received really didn't meet my needs. And I had to do a panicked self-discharge against medical advice a few hours after I came around after surgery. Not long after that, I moved into a new role at Swansea University, and I just needed to apply for funding for anything that fit within the maternity area. So I started looking at autistic people's experiences of maternity, and there really wasn't very much known. Not long after this, I decided, right, I'm going to apply for a really big grant, and I spoke with the very lovely people in the public involvement team at Health and Care Research Wales. And they said they could give me a small amount of funding to pay for some advocates who knew much more than I did at that stage in my career about what it was like to be autistic and to be pregnant. So Catherine Williams and Willow Holloway joined me over the course of a few months. We had meetings, we had late night messenger discussions. They were really, really involved. And the most important thing to me is they were being paid £25 an hour for every single hour they were involved. That meant I felt I could ask them ethically to review the whole grant application. I was then successful in securing £2.4 million from the Wellcome Trust to do the Autism from Menstruation to Menopause project. You may notice I've gone from pregnancy, from periods all the way up to later life, and that was also down to PPI, but that's a story for another day. The project is autistic-led by me. I have 4 postdoctoral researchers, and they're also all autistic. And I have a brilliant community council of 11 autistic people. It was important to me that we accessibly recruited our community council so we could get the underserved parts of the autistic community. Most autism research is people who are white, middle class, and highly educated. Having a PhD is common in PPI reps in autism studies. They aren't really PPI reps. So we did lots to make that process accessible, but it didn't stop there. I have a monthly community council meeting, and it's really important to me that's accessible. I think I'm doing a good job because we've retained 11 of the 12 people who joined. And some of the things I do involve having really detailed notes. So I have a 7-page summary, that's my summary, of all of the things I need to do at every step to make the processes accessible for each of my 11 people who have different needs. We also have something called our standard reminders, and they were developed by the council. And they're not rules, they're a statement of inclusivity, of saying this is a learning environment. It's okay to make mistakes. It's okay to be autistic. You're not going to be judged here. You know, if you forget to come back from the break, it's okay to turn up 25 minutes into the second half of the meeting. That's not a problem. So it's important to me we're not just paying lip service to inclusivity. So every year we're asking our council members, what do they think about being on the council? And that's being done by somebody who isn't me, so they can feel free to talk more openly. You can see from some of the comments on the slide, our feedback this year when we had our first full year of the council was overwhelmingly positive. We had some small areas for improvement and we've worked those through. But the thing I'd like to draw your attention to on the slide is the first bubble on the top left. And the person here has said, it's empowering being in a group that's doing this. It's demonstrated what can be done if funders provide the time and money. I'd like you all to take that away today. That's the most important thing for me. But we're not just having a community council who are hanging out and spending a lot of time making it accessible. We're also doing a really big programme of research. So I'm doing a qualitative longitudinal study, and what that means is I'm inviting 100 people from underserved parts of the autistic community to be participants in the study. And the hope is that each of them will do 10 interviews. And we want to hear about whatever part of their reproductive health is currently most important to them. By interviewing people every 6 months, the hope is they'll have something new to tell us each time. They've just had a smear test. They had to go and have a mammogram. They've changed contraception. We'll have these different things happening, and we'll already have these people in our study. We've recently started wave 2 of our interviews, and so far we haven't had anybody drop out of the study. Dropout rates in autism research are normally really high. But it's actually, we're doing better than that. Some of our participants have formed such good relationships with their researchers that they've actually proactively contacted them and gone, "Hi, I think it's time for my next interview. When are we doing it?" So that safe and comfortable ethos from the Community Council has been brought through our participant-facing materials. The scripts that our researchers are basing their conversations off have got accessibility woven the whole way through. And this is really important because when we're thinking about the potential impacts of this study, 98% of autism research is focused on children. We need more knowledge about what happens to autistic adults, and particularly autistic adults who were assigned female at birth, because the whole reproductive health area is understudied. We're also going to be co-developing resources in years 7 and 8 of the project, and that will involve the Community Council, but they're going to be involved in everything. So they've designed the participant-facing resources. They will be involved in analysing the data. There'll be authors on the papers, and they will be there with me when we're creating these resources. And I think that gives us the best chance of them meeting the needs of the more underserved parts of the autistic community. Now, I've been talking to you today about autism, but really I could be talking about any disability or health condition. Any of you here in the room who are researchers, who are PPI reps, if you think about who are the PPI reps on your studies, they are normally very experienced, and I would argue many aren't lay anymore. And they are brilliant. We absolutely need them. They were invaluable in my study in getting the recruitment process for our more lay reps right. So we did get those underserved communities. But they shouldn't be the only voice in the room. And we do need truly lay people to guide our research, because else we're not going to access those parts of the communities you're trying to reach. A few years ago, I saw something that said that we should have 1% of any study's budget spent on PPI. I think that's woefully inadequate. About 5% of my budget is spent just on those £25 per hour payments throughout this 8-year study. Also, realistically, about 40% of my time goes to making this study as accessible as it is for the Community Council. So I'd say about 10% of my budget goes on PPI, and I think that's something that we should be aiming for on our studies. We should be aiming higher. I can imagine many of you who've submitted grant applications and had things refused on cost grounds might be thinking this is entirely unrealistic. It will delay the science and funders won't pay for it. But I think if we all here today make a commitment that we're going to build in more in-depth, more accessible PPI, funders will start to expect it and they will fund it. Wellcome did not question £120,000 on honorariums, not even mentioned. So my final take-home message for you today then is if you want your research to benefit the publics you're aiming at, you cannot afford not to hear from the most underserved in those groups. And I would ask you all to go one step further and to involve them as partners. Thank you very much.